has India's biggest school market. Nagpur has India's biggest orange market and farms. It is first in the country to implement 24/7 water supply scheme. Nagpur was founded in 1702 AD and has a population of 46,53,171, more than the country of New Zealand and Oman. It is also known as Orange City and Bagpur.
Hello, I'm Dr. Hemant Chhajed. I'm working with Wockhardt Hospital's Nagpur as a consultant minimal access surgeon. I've been associated with Wockhardt Hospital for last 2.5 years. I got trained in general surgery from Gajra Raja Medical College, Gwalior. Later on, I moved on to UK for minimal access surgery training. I got trained there in Aberdeen and Leeds General Infirmary. After training, I came back to India and been practicing here since last 4 years, and my main area of interest is laparoscopic colorectal surgery. We have been doing all minimal access work, right from operations for appendix to gallbladder to hernias. We have also been doing lot of complex hernias with minimal access surgery. The main area of interest being colorectal surgery. We have been doing all complicated cancers of colorectal surgery, likely the name being right hemicolectomy, left hemicolectomy, anterior resections, APRs. We have been doing them on a very regular basis. It's the main area of interest where I have been trained into, and we have been doing all minimal access work rather than doing by open technique. Normally when patients come to us, they normally come with complaints of pain abdomen, and they can be into any of the areas, right from appendix to gallbladder problems to issues with the acidity related issues. We normally assess the patients here and we identify what is the cause and then treat them accordingly. As the patient is diagnosed with, say, cholecystitis or infection in the gallbladder or gallbladder stones, they are suggested to go ahead for gallbladder surgery, removal surgery, which is done by laparoscopy these days. There can be patients coming in with complaints of swelling in the abdomen, which is one of the form of the hernias. In that case, we offer them surgical repair, that too laparoscopically. So we place all type of meshes, whatever is required according to the case, and we operate the patient by minimal access. A lot of patients come to us with complaints of having bleeding from the back passage. They are not always just simple cases of hemorrhoids or piles. They can be at times because of the cancers from the large intestine, which is the colon. So we always say you have to undergo endoscopies for that, so that we identify these cancers early. And once we come to know if there's somebody suffering from cancer of the colon, we suggest them to go ahead for laparoscopic procedures, so that for the removal of the cancer. These procedures are done by laparoscopy, and we normally complete all these procedures by minimal access only. The whole idea is, when we do by laparoscopy, there is minimum pain. The patient goes back home very early, quickly, because the incisions are very, very small. We make very small holes and the instruments are passed inside and the procedure is completed. And because of the advanced technology that we have got now, we are able to join the bowel back together using staplers, which are available for use by minimal access by laparoscopy also nowadays. I returned from UK and I was looking for a place where I could perform my surgeries without having trouble regarding the care of my patients. So that is why I chose Wockhardt, and when I started working here I was very comfortable, because since I've been in UK to coming back and working in a good environment where patient care is the priority, and ICU care is very good. So because of that, I was able to do complicated surgeries as well in the Wockhardt environment. Since I have been here last 2.5 years, I can say that it has been a very good experience, and the patient care that we get under one roof is very good. We have got multi-speciality. It is a multi-speciality hospital, and we have got all super specialists available. So it is a tertiary care center where we can offer most of the things to most of the patients.